Hello and welcome to IC Healer's YouTube presentation. I am Mandy, the founder of IC Healer. IC Healer is an online clinic that serves to help educate individuals with interstitial cystitis and bladder pain syndrome to help folks identify their root cause and find healing opportunities so they can live the life they deserve. Before we begin, I just want to remind you that the purpose of this presentation is for informational purposes only and not intended to be a substitute for medical advice. Always seek the advice of your physician with any questions you have regarding a medical condition. So if you're tuning in here, you're probably searching for answers like I was 4 years ago. And those of you who know my story, I suffered with ICBPS for about 10 years. I reached the pit of my struggles with this debilitating condition about 4 to 5 years ago when I decided it was time to turn things around and I started to aggressively pursue my credentials in functional nutrition. Now, if you're looking at the slide here, chances are you're probably eating a lot of foods on the right side, which is things that are high in oxalates. So this particular presentation is going to be talking about the link to oxalates with IC. And that was me as well. Actually, a few years ago, I was actually transforming into a vegan, and I was slowly cutting out meat because I thought meat was the devil, and I was eating more plant-based foods. During this time, I noticed I was experiencing a ton of UTIs, like one every month. That's when I stumbled upon a YouTube video from our guest speaker today, Elliot, that I realized that perhaps there was something about my plant-based diet that may have been contributing to this problem. I had a few meetings with him, and that confirmed that this could be the culprit. Now, don't get me wrong, I already knew about oxalate a few years prior, actually 10 years prior, but I chose to ignore it because, just like many other healthy eaters, I was convinced that plant-based eating is healthier. So what is going on here? Well, we talk about this in the IC Healer course, and I want to walk you through, I will be walking you through a low oxalate diet in the course, but also in our group coaching program. So when you end this presentation, you might come out of here thinking, oh my gosh, I'm so confused. Don't worry, we have programs lined up for you so that you can really find your path to healing. But if you're a victim of eating a ton of those foods, well, they're high in oxalates, and oxalates are basically anti-nutrients. So foods such as plantains, raspberries, kiwi, figs, potatoes and sweet potatoes, and the worst, spinach, is what contains these anti-nutrients. And they combine with minerals such as calcium, magnesium, and iron in your food and prevent the absorption into your body, which is a lot of reasons why we end up being very nutrient depleted. Now, in healthy individuals, moderate quantities of oxalates shouldn't be an issue. But if you've been subject to antibiotic overuse or have some deficiencies or fat malabsorption or, of course, leaky gut or certain genetic SNPs or variations, then it's possible that oxalates are contributing to your pain. Okay, so what are some of these symptoms? Well, this slide is basically going through some of the symptoms, which is very common in the ICBPS population. So if you have had at least 3 of these on a regular basis, it's very likely that you are a victim of oxalate poisoning or oxalate impairments. Okay, so take a close look at that. And if that sounds like you, then this presentation is for you. Okay. And finally, we talk about genetics in the course. And we will be talking about genetics also in group coaching, but there are definitely genes involved in making you more susceptible to this problem. You may be an endogenous producer. So that's something also to take into consideration, and there are some tests you can do to identify your genetic susceptibility. And I'm sure Elliot's going to talk a little bit about some of the tests as well. So before we officially introduce Elliot, I'd like to introduce him. He's been very helpful for me and really eye-opening. I had a few consults with him, and not only is he super smart, he's really easy to work with. He's trained as a nutrition therapist at the College of Naturopathic Medicine in the UK, and later he gained a qualification in functional medicine. He's now undertaking an advanced fellowship in anti-aging medicine and metabolic functional medicine with A4M. His approach is one that incorporates naturopathic philosophy, nutritional science, and functional medicine in a holistic formula. And he's very good at using complex science research. So he uses a lot of science research, but he puts it in a way that's easy for you to understand. And he puts it in a lot of common sense, which a lot of doctors don't do. So it's very nice to hear the common sense approach. And he helps you provide long-term sustainable solutions to regain your health and vitality, which is what we all want. His approach is based on the notion that the human body possesses an innate intelligence. So basically, the human body has the ability to heal. And when provided with the correct raw materials, that means nutrition and environmental things and environmental conditions, it can correct most of its problems. So that's what I believe as well. I believe that the body has the ability to heal. So without any more delay, let's go ahead and introduce Elliot. Hi there.
Hi, thanks for having me on, Mandy.
Thank you for coming. We are really happy to have you, and we'd love to talk more about oxalates. But before we do, tell us how you got into studying nutrition and how you became very interested in biochem.
Okay, so when I was about 19, I went traveling, went through South Asia. And at that time, I was a vegetarian. I'd been a vegetarian for a long period of time. All throughout my childhood, because there was indeed an emotional component, but I was also led to believe that this was a healthier thing to do. Mm-hmm. And so I developed some kind of chronic digestive issues when I was away backpacking, and came back to the UK after 9 months, a year or so. And I wasn't satisfied with the advice that I was given from my primary care doctor. And so I did some research on my own. I did some research kind of on the internet, on Google, so to speak. And I came across a lot of information which implicated nutrition in how to improve what was going on, what I was experiencing at that time. So then I started playing around with different diets, and I found like the Weston A. Price Foundation, kind of what you would call paleo or ketogenic circles of nutrition, and tried things out. And I was actually surprised to find that I could manage to effectively resolve my digestive issues. And so that, coupled with, I've always kind of been interested in what you might call kind of natural or traditional, non-conventional healing methods like acupuncture and whatnot. And so, yeah, I just discovered that I had a really keen interest in learning about how the body worked, and then learning about things that you could do to improve chronic health conditions, because we see so many people are sick in our modern day world. And it's like, well, if you look at modern medicine, it seems that it's very symptom focused and pharmaceutical based. And oftentimes you see that people actually, they don't improve. They don't overcome the health conditions. They just stagnate or they get worse. And so, you know, kind of, I've always been a little bit, what's the word? I like to find out how things work and try to find solutions to things. And so, yeah, I became fairly convinced that nutrition and other natural modalities were could be a very effective solution for people. So I decided to study it.
Well, we're glad that you have studied it, and you've been able to really dig into the IC connection to oxalates. And that's been really important, because I think a lot of people listening are still convinced that the plant-based way of eating is the way to go. And that's blame the media for that. I mean, because that's what people are talking about online. So if you want to go ahead and start your presentation, you can go ahead and do that if you like.
Yeah, of course. Fantastic. So I am sharing my screen now. Can you see it?
Yep.
Okay, perfect. Right, yes. So today I've put together some slides, essentially on, if I just put this down here. Yeah, it's essentially on, you know, the topic of everything that you really talk about, Mandy. With regard to interstitial cystitis, I became particularly interested in this concept or in this topic after learning about what we call oxalates. So you've given a very good introduction to those. Essentially, in today's presentation, I'd like to just go through some of the potential mechanisms as to how this can be, at least for some people, a root cause for why they are suffering from interstitial cystitis, bladder pain syndrome, and also perhaps even chronic urinary tract infections. And so oftentimes the people that I work with who do have these issues, they generally see good benefits when we focus on oxalates. And now I'm not saying that this is applicable to everyone, because of course it's individual and there's lots of different things that can be involved here. It's a very complex condition, but ultimately I am convinced that there is a subsection of people who this is the driving factor behind it. Okay. Mm-hmm. So oxalate toxicity. First of all, let's just go through the basics. What are oxalates? So for the listeners who aren't familiar with this concept, there's lots of information available online now, but ultimately the very basics of it is that oxalate is referring to it's an organic acid. It's a natural acid which is found in plants. So this is actually called oxalic acid, okay? And it's found in all throughout the plant kingdom, but it's found in certain plants much more than others. So you saw the high oxalate food list before. Oftentimes many of the vegetables that we eat frequently that we're told are healthy actually contain very high levels of this oxalic acid. Now, you can think of oxalic acid a bit like a magnet, in that it has a very strong negative charge and a high affinity for minerals. And so when it comes into contact with certain minerals, it binds very tightly to them. And when you have oxalic acid binding with a mineral, it produces something called an oxalate salt. So when I say the word oxalate, I'm referring to oxalic acid bound with some kind of mineral, okay? Now, much like a magnet, when you have this binding to a mineral, you can have two different types of oxalate which is produced. So you have an insoluble oxalate and you have soluble oxalate. Insoluble and soluble are referring to whether they are soluble or not in water. And so certain types of insoluble oxalates, such as calcium and magnesium, and then there are other types of soluble oxalates such as potassium and sodium. And so the oxalate or the oxalic acid has a very, very, very high affinity for calcium. It will preferentially bind with calcium over other minerals. And that's something important to note. The structure of the oxalate crystal, or when it forms, when you have this binding to a mineral, you can essentially have the development of various different structures. So these are referred to as crystals, and these can form in a wide variety of shapes and sizes. So you may have the development of large stone-like formations, or you can also have very, very, very small micron and nano-sized crystals which develop. And what these typically do, one of the reasons why they are in plants, first of all, is that they are employed as a defense mechanism. So certain plants, they don't have legs to run away with, but all plants have inbuilt defense mechanisms to prevent them from being eaten. So actually, one of the ways that plants use oxalate is to prevent herbivores from eating too much. And the way that this occurs, or one of the ways primarily, is due to the structural qualities of the oxalate crystal. It can form very sharp structures. It can form kind of here are some pictures. So these are referred to as raphides, and these are very long needle-like structures. And then you also have these different kinds of things as well. So you see that they exist in kind of crystals and diamonds and all of these things, and they're very spiky. And what they can actually do is they can lodge in the soft tissues all throughout the GI tract. And what this does is it can actually cause irritation and inflammation. So one of the things that your audience may be familiar with is after eating a kiwi fruit. This is very common in people. After eating kiwi fruit, their mouth may become uncomfortable. It may become itchy or scratchy. Now, people often find that when they eat foods high in oxalate, they may develop like a sore throat, and they may develop like a kind of scratchy mouth kind of feeling. And sometimes I think this is due to the oxalates, okay?
Wow, so I always thought it was the acid. I didn't realize that.
Yeah, well, I did as well. I never knew that. But then actually looking through the clinical literature, it says about the oxalic acid, the oxalate content of kiwi being one of the things which is theorized to cause that effect in the mouth. So, yeah, essentially, when we eat certain plants containing this toxin, and essentially this is a form of toxin, when we eat plants containing this toxin, then essentially it's important to note that we are only going to absorb a certain fraction of the oxalate contained within the food. And the amount that we absorb is going to depend on several things, but one of those is whether the oxalate is soluble or insoluble. So we are not going to absorb insoluble oxalate. We're not going to absorb, if oxalate is bound with calcium, if there's a food which is high in calcium oxalate, we are not going to absorb that. That's not to say that it's not going to cause us lots of damage. So for instance, it can cause kind of mechanical stress and irritation to the esophagus, to the stomach lining, all throughout the intestines, and kind of tear shreds of the tissue as it's going down if there's enough of it. But that's not going to be absorbed. On the other hand, when we have certain soluble types of oxalate, such as potassium or sodium oxalate, that is absorbed, okay? That can be absorbed all throughout the GI tract. It's mostly absorbed via certain transporters in the intestine, okay? Now, when we absorb oxalate, if there's a small amount, it's generally not a problem. So it's absorbed into the blood and it goes directly to the liver. Once it goes to the liver, then it goes to the heart, then to the lungs, all throughout the circulatory system, and then we excrete it through the kidneys. Okay, so that's ordinarily how we get rid of this. Now, sometimes what we can also do is we can absorb a bit into the bloodstream and then pump it back into the intestine. So when the body absorbs oxalate, we can't really do anything with it. We just need to get rid of it. And it's not typically detoxified like through, when you're thinking of detoxification, you look at the several types of pathways in the liver, the phase 2 pathways, which are essentially very specific for certain molecules. What we do is we conjugate them with certain biochemical mediators, glutathione or sulfate or some other kind of amino acid, and then we carry them out. And that's a detoxification pathway. But oxalate we don't have any specific detoxification route for oxalate. And so actually the body just tries to get rid of it in any way that it can. It's primarily through the kidneys and the gut. But as we will see, we can actually get rid of it in some other ways as well. Now, a small amount of oxalate coming from the diet is generally not going to be problematic. However, when we are consuming quite a high level for a sustained period of time, and if you think back to the types of foods that Mandy has already showed, many of the so-called superfoods, which we're told that we should be eating a lot of in our daily diet, which we likely wouldn't have had access to just a couple of decades ago, many of these foods are extraordinarily high. And so what this means is that many of us can go for long periods of time consuming very high levels of oxalate. And so the kidney can only deal with so much at any one given time. And so actually what can happen is that when we have a high intake, it's going into the blood, it's propping up the blood level. And as it's traveling throughout the blood, you can have damage done to the vascular lining, so to the blood vessels. You can have damage done to the various organs. You have high levels of oxalate in the liver. It can affect how the liver is working. High levels in the heart can affect certain things. And it can travel all throughout the body, essentially, wherever the blood is going. And now, when it comes into contact with certain minerals in the blood, for instance, when it comes into contact with calcium, then what can happen is the oxalate is binding with the calcium, forming or precipitating as a calcium oxalate crystal. And now this can occur in many different organs, many different parts of the body. We can develop these crystals. It's essentially that we are accumulating oxalate in the form of calcium oxalate crystals, and these have been identified in just a wide variety of organs. So for instance, it has been shown that people have had or it's quite common to have calcium oxalate crystals in the thyroid gland. They've been found in the eyes, in the aorta, so in the blood vessels. They can deposit in practically every known organ. They can get into the brain, they can get into the joints, particularly damaging in the joints because the joints have a very low level of blood supply, so it can be quite difficult to clear oxalate when it has been developed in the joints. And now there is actually a condition referred to as oxalate-related arthropathy, which mimics every symptom of arthritis, but actually is caused purely from calcium oxalate deposition in the joints. Mm-hmm. And some people might say that, or there are certain individuals with fibromyalgia who it is possible that oxalate crystals have deposited in the muscles. And some of these people feel that when they go for a massage or when they feel their soft tissues, they can actually feel kind of crystal, sharp like feelings and structures and things coming out. And this has been something which is among the oxalate community, people who have clear oxalate problems. This is quite common to feel kind of crunching in the joints and things like that. And so oxalate is like I just said, oxalate, when it deposits, it can cause mechanical damage. You think of it like a shard of glass in the joint, in the muscle. Every time you're moving, when you're active, what's happening is it essentially like tearing away at your connective tissue, at your nerves. It can affect how the nervous system is working. But when you consider that oxalate is actually a mineral chelator, then it has a very strong effect on the minerals in our body, and the balance of potassium and sodium and magnesium is very important for how well cells are functioning. So actually, when you have high levels of oxalate in the body, it can really disrupt how we process minerals and the overall mineral balance. Not only can it cause mechanical stress, though, it can also get into the cells. And when it gets into the cells, then it can affect several different enzymes involved in how well we're making energy. And so if we can't make energy very well, then we're going to be susceptible to lots of different health problems further on down the line. But essentially, oxalate has been implicated in how well cells are able to repair the damage, how well they're able to effectively make energy and kind of do the things they need to do. And then one more thing is that when oxalate, either when it gets into the cells or when it's purely present as a calcium oxalate crystal, can promote inflammation. This is really important because we live in a world which is kind of promotes a state of chronic inflammation anyway. We come into contact with just a wide variety of stresses all of the time. And so our bodies are already somewhat burdened just by modern life in the 21st century. But then when we add in the concept that actually when we have a high oxalate burden in the body, when we chronically elevated levels coming in from the diet or from the gut, then essentially what this is going to do is activate the immune system. And so oxalate has not only been implicated in certain kind of traditional oxalate-related health conditions, but also things like autoimmunity due to its sustained activation of the immune response, okay? So if I can just go back. Right. Okay. Yeah. So here's just a good diagram from one of the research papers. For anyone who wants to go into the details, it's just showing how you have certain types of oxalate crystals. When they do get into the cell, this is how they're affecting. So they can actually rupture the cell membranes, cause the cells to burst open and leak their contents. And it can affect just a wide variety of processes inside the cells and how the cells work. Now, if you were to ask a traditional doctor or traditional kind of practitioner of any kind of conventional medicine, then if you asked about oxalate problems, then they would immediately refer to kidney stones. So kidney stones are, you can think of like the prototypical oxalate-related illness. In fact, oxalate, 80% of all kidney stones are composed of calcium oxalate stones. So this is when the kidneys are basically trying to filter out and get rid of oxalate, where it is precipitating as a stone and it actually becomes lodged in the kidneys. So you have a deposit of this stone, this calcium oxalate in the kidneys, and it's causing things like oxidative stress. It's affecting how well you can clear out other toxins, etc. And now the research literature, unfortunately, most of the research on oxalate is focused purely on kidney stones, in that there's this belief that the only problem, or if someone has problems with oxalates, the only thing that it's going to cause is kidney stones. Unfortunately, it's not very well acknowledged that oxalates can affect every single other organ. Okay, now there are many other kind of associated conditions, and these are the types of people who you see who do have oxalate problems and oxalate burden. As I said, a kind of unexplained joint and muscle pains, or something which mimics arthritis. You can have problems with the nerves, how the nerves are functioning, so neuropathy, certain types of cardiovascular diseases, autoimmune conditions, hypothyroid, because when they lodge into the thyroid gland, they affect how well your thyroid works. On the topic of today's talk, primarily though, vulvodynia and urinary tract infections and interstitial cystitis. So there are many people who found amazing benefits in their vaginal pain, in their kind of urinary issues, urinary kind of dysfunction, by adopting a lower oxalate diet. So on the topic of today's talk, interstitial cystitis. So when I first learned about this condition, when I was first kind of working with people with the condition, I couldn't help but think that this was kind of something like a sham diagnosis. And I hope you'll understand what I mean when I say that. It's a collection of symptoms, but there's no unified theory for why this occurs. And I think this is probably because there are just a multitude of different factors which go into this, and each cause is going to be different for each person. But ultimately, this collection of symptoms, as I understand it, it can be severely debilitating, right? And unfortunately, with the people that I've worked with, there's not really much relief, or there's not many traditional treatment options which are offered to someone with this kind of condition. There are not many kind of medications or anything which have provided any kind of sustained or long-term benefit. And so the symptoms: frequent urination, urinary irritation, burning and sharp stabbing pains, which I have some clients who explain this feeling as though shards of glass are being poked into the bladder or throughout the urinary tract. And there's also sometimes microscopic bleeding. So actually on a urinalysis, there may be trace amounts of blood which can't be seen with the naked eye when there is no urinary tract infection. And so actually someone may go to the GP, they may see that there's blood, but actually they go for a urinary culture and they find that there is no bacteria per se, but that they are presenting with many of the same symptoms. And so some of the basic things, I'm sure, your audience are already familiar with this, but this concept of the bladder epithelium, so the lining in the bladder becoming leaky, a bit like the gut becoming leaky. And once that occurs, you're having kind of contents which are meant to be coming out through urination. So anything that's passed throughout the urine is able to cross through that epithelial barrier and actually activate inflammation. So in the lining of the bladder, activate immune cells, influence how well the nerves are functioning. So how well you can control the bladder, because the neurons are very sensitive. And overall, just a heightened sensitivity to dietary components, so spicy foods or coffee or anything acidic, or, there's lots of different foods, as I'm sure you talk about. But essentially what it means is that the function of the bladder, it's not working as it should, right? And we're in the business of trying to find out what is causing this in the first place. And so I'm fairly certain that oxalates can be a cause of a leaky bladder, or oxalates can be a cause of an irritated bladder. And so this little diagram here, it's taken from one of the websites on the web. Essentially, it's a diagram showing how we were talking previously about kidney stones, about how this is very well acknowledged and kind of well known. Anyone that you speak to likely knows someone or has heard about having a kidney stones. But what many people don't know, although conventional medical doctors do know, what many people don't know is that you can actually develop bladder stones. So essentially, when someone has a kidney stone, they may be able to pass the stone from the kidney to the bladder, but then it can become lodged or deposited in the bladder as well. And this is actually more common than is frequently thought to be.
Yeah, I had that happen to me. I had it on my urethra. I had a urethra stone.
Yeah. The medical terminology is urethrolysis.
Yes.
And looking at the research on this is fascinating, because I've never personally known anyone who has known that they had this, but actually it seems to be more common than not. And there's a very interesting study that came out in 2013, and it's titled Association of Bladder Pain Syndrome and Interstitial Cystitis with Urinary Calculus. So what they actually found was that there was a significant association with people who had previously had urinary calculus, so stones coming out in the urine, either from the bladder, from the kidneys, and that actually they hypothesized, the researchers based on this data, they said this work generates the hypothesis that urinary stones may be associated with BPSIC. Now that's fairly obvious, but actually when you read the paper, it's interesting what they said. They said it's possible that the stone could cause irritation, setting up a cascade of interrelated inflammatory events, leading to a self-reinforcing cycle of persistent inflammation and recurrent injury to the bladder epithelium, potentially leading to alterations in the local environment. So if you look at the research on interstitial cystitis, it's like, okay, there's something which is affecting the bladder epithelium, there's something which is irritating the bladder lining, and then the reactions to all of the foods kind of potentially come after that initial event. Right. So it's like there's the stressor which is affecting the bladder wall, and then that makes you more sensitive to something like spicy food. But it's not necessarily the spicy food which is causing the bladder issue in the first place, right? So, and whilst it may be for some people, ultimately what these are hypothesizing is this is possible that the stones themselves may be a trigger for bladder pain syndrome and interstitial cystitis. So it's interesting here. So what we see is that when we have these kidney stones, you may not have kidney stones. There are many cases when someone does have kidney stones, they don't even have any symptoms of it. Someone may be passing stones which are not causing pain, which are not causing irritation. They can actually lodge in the bladder. They can lodge throughout the lower urinary tract and then go on to cause symptoms, and they've not been picked up previously. So this is where oxalate comes in. Now, there's another interesting research paper. It's actually focusing on males, talking about benign prostatic hyperplasia and urinary stasis. But what they were finding was that the same thing was occurring, was that actually bladder calculi was potentially one of the causes for the bladder symptoms, so the bladder issues, or the dysfunctional emptying of the bladder and whatnot, rather than being a cause of, it was rather than it being caused by urinary stasis. What they actually hypothesized was that the bladder stones themselves may have been causing the bladder problems. So if you look at the research, it turns out that there's actually quite a large proportion of these stones have been identified as calcium oxalate crystals. Okay.
Urinary stasis is the same thing as retention?
Yes, yeah.
Okay, that's what was happening to me when I found out I had the urethral stone. I had retention.
Yeah, well, if you look at again, I don't mean to paint everyone with the same brush, but in the context of someone who has bladder dysfunction, which is potentially being caused by calcium oxalate, if we look at the structure of the calcium oxalate crystal, we look at the effect it has on not only immune cells. So we know that it activates immune cells. We know that it can lodge into tissue, a bit like a shard of glass, and cause mechanical irritation. So to deplete the kind of local resources in that tissue. But then at the same time, what we also know is that it can affect neurological function. So it's affecting how well the cells are able to, what's a process called depolarization, whereby nerve cells are conducting nerve signals, and it's affecting the balance of the minerals. So essentially, oxalate can potentially, affect the bladder on multiple different levels, whether it's immune, neural, and kind of just tissue level. Okay.
Yeah.
And now, as I've said here, the crystals of oxalate crystals are kind of prime suspects in my opinion for many people, and that's because micron and nano-sized crystals can puncture cells. They can irritate tissues, nerves, and immune cells. They've been shown to do it. This lovely diagram shows exactly how they affect all of the processes in the cell, and therefore oxalate crystals fit the criteria for inducing stress found in interstitial cystitis. Okay, now what is often coexisting, or there's, as you know, there's cycles. So someone who has interstitial cystitis may already, or may also have been diagnosed with chronic UTIs. Then again, they may not have, but then someone with chronic UTIs may not have been diagnosed with interstitial cystitis. So they can kind of coexist, or they can kind of be exclusive from one another. But what we see in UTIs is that oxalate is also involved here. This is because, right, so for the bladder is ordinarily meant to have a sterile lining, you could say. Your immune cells release something called secretory IgA, which you can think of it a bit like an antiseptic paint. And you have these things called proteoglycans and glycosaminoglycans, which are like kind of promoting a very moist and fluid layer lining the bladder, which is ordinarily designed to prevent bacteria from lodging in the bladder wall. Okay, but the problem is that in chronic urinary tract infections or kind of embedded infections, there seems to be something which is influencing the physiology of the bladder, and the bladder wall is a lot more susceptible to bacterial adhesion. Okay, and so what we see is that if you look at kind of how bacteria lodge on stick to the bladder wall, it's usually when the tissue is damaged or stressed or depleted in some kind of nutrients, it's not functioning as it should be. Now, it turns out that bacteria can aggregate in and on calcium oxalate crystals. So there's a very interesting research paper, and it's called the interaction between E. coli or Enterobacteriaceae, if that's how you pronounce it, okay, and calcium oxalate deposits. But essentially what they found was that E. coli, which makes up, the large majority of all urinary tract infections, as per my understanding, E. coli can selectively aggregate on and around calcium oxalate crystals. And they conclude, therefore, renal calcium oxalate deposits, so for instance calcium deposited in the kidneys, but which can also apply to the bladder and throughout the urinary tract, because we know that this happens. So the calcium oxalate deposits may be a modifiable risk factor for infections of the kidney and urinary tract. Furthermore, bacteria may be present in calcium oxalate deposits and potentially contribute to calcium oxalate renal disease. So what we know is that if you have these sustained release of elevated oxalate through the kidneys, through the bladder, and if you've got oxalate nanocrystals or micron-sized crystals or stones even, which are lodged in the tissue, the soft tissue going out from the kidneys to the bladder, this is potentially going to harbor bacteria. You see, even though if you've got healthy bladder tissue, but if there's oxalate stones, kind of, the way I like to conceptualize it is if you have some kind of, you think about it like a soft piece of tissue, and then you stick some shards of glass in it, then essentially it's potentially acting as like a hub or a house for where bacteria can kind of thrive off. Okay. Yeah.
And, honestly, what we found with IC is the Enterococcus is actually, faecalis is actually the more prevalent bacteria that we're seeing in the chronic UTI, chronic IC situation when we run the DNA testing. And I'm almost wondering, because Enterococcus is an oxalate degrading bacteria, I'm wondering if that is cause what you just showed us with the E. coli is also happening with the Enterococcus with this population because of the presence of oxalates. Another thing I thought you said was really interesting was the secretory IgA. That I looked at some studies, although scientists for whatever reason aren't looking at this today as much as they did in the 80s, but there's a lot of studies in the 80s where they were doing UTI studies, chronic UTI studies with children, and they identified that secretory IgA was low in this population, and you just talked about this. So you believe that the oxalates are causing this depletion of secretory IgA?
I mean, I think it's possible.
Yeah, because you just said how the structure changes, and yeah.
I mean, the thing is, if you look at, there are tissue-specific effects of oxalate. So when you have oxalate which is present in a tissue, what we know is that it depletes B6. It depletes glutathione. It depletes like many of the cellular resources that you use to maintain a healthy, robust tissue, especially like an epithelial tissue. Mm-hmm. So what we also know is that you have oxalate in the kidneys. Elevated levels of oxalate can actually disrupt the proteins which are responsible for maintaining the kidney barrier. Okay, so the kidneys, the bladder, and the most tissues, but let's, for kind of this presentation's sake, the kidney, the bladder, and the gut all have an epithelial kind of leaky barrier, which can become leaky and which can kind of then tighten back up. It's made up by tight junctions, okay? Now, essentially what they've shown is that oxalate levels in the kidneys, high levels of oxalate can cause a leaky barrier in the kidneys. And that's disrupting the same types of proteins which also exist in the gut and which, as per my understanding, also exist in the bladder. Mm-hmm. And so essentially, if you, if you've got high levels of oxalate for a sustained level of time, it's very, I think it's very possible that it could cause low SIG-IgA. It could kind of deplete the tissues of vitamins and minerals and things, but at the same time can also cause that leaky barrier and then kind of trigger that cascade for all of the things, kind of downstream effects of IC to occur. Does that make sense?
Yes.
Just one more thing about Candida. So oftentimes what you might see in someone who has oxalate problems is not only the urinary symptoms, so the frequent urination, the kind of IC, bladder pain syndrome, chronic UTIs are often present, but you also see chronic vaginal yeast infections in many people as well. And what's very interesting is that when you look in a petri dish, at least, and I think that this occurs in the gut, I would not be surprised if this also occurs in the reproductive tract, is you see that essentially there's this idea that Candida is the cause for oxalates in the functional medicine community. This idea that Candida is a cause for oxalates. But if you actually look deeply into it, there's very little research to support that notion. In fact, there was one very interesting paper which showed that when you feed Candida high levels of oxalate, such as if you were having a very high oxalate diet, what it does is it causes Candida, or what it potentially is doing in the gut anyway, this is in a petri dish, they showed that when you fed it too much, it caused the Candida to go from its kind of friendly form, its commensal form, which it exists in everyone. It went from being its friendly form to a hyphal pathogenic form, which is what you would see in systemic candidiasis or actual pathogenic Candida infection, where it goes, it seems to be activating a stress response in the Candida. So the Candida need to make energy, and that when you feed it with too much oxalate, it stops how well the Candida can make energy. So they go into like defense mode, and therefore they start like becoming pathogenic. So what I actually suspect is happening is that a chronically high level of oxalate is potentially causing people to develop chronic kind of Candida infections, which are not responding to antifungals. Antifungals may even be stressing out the Candida more. And unfortunately, what you find is that people who do have this issue, when they cut oxalates or when they start reducing oxalates in the diet, then actually they see many different types of benefits. One of those is yeast infections. Oftentimes they disappear. Okay. And that can be a gradual thing. I've just said here, is it a cause for gut dysbiosis? It's very well established that gut issues can cause us to absorb more oxalate, which we'll look at in a second. But actually, there's also potentially some research to indicate that when you have a very high level of oxalate coming in the diet, what it's doing is it's toxic to certain microbes as well. And this involves the beneficial microbes, so the microbes in our gut which protect us from oxalates, from helping to degrade them, and also kind of modulating our metabolism in lots of different ways. When you give them too much oxalate, you can actually inhibit their growth and kill them off. Okay. So very simply, high oxalate diets, many of the so-called superfoods, are extraordinarily high. This is really problematic. You had an excellent list. Here's just another couple of those foods: raw cacao, tea, rhubarb, spinach. If you're juicing, if you're doing smoothies, this is going to be highly problematic. As I've put down here, 1 cup of almond flour, what you find is that many people who go on grain-free diets because they think it's healthy, so they go on a wheat-free, kind of casein-free diet, what will happen is they might use something like almond flour. If you look on a GAPS diet, there's many kind of autistic children who are put on almond flour. Well, 1 cup is approximately 220 milligrams of oxalates, whereas if you are using almond milk, if you are using spinach, if you're using kind of turmeric and cinnamon in a smoothie every day, you can you can have more than 1.2 grams of oxalate. And just for the listener to kind of understand, it's recommended that someone should go nowhere above 150 milligrams. And that's a conservative estimate. So what you're potentially doing by having these smoothies and these very high oxalate foods, you're potentially having 10 times the kind of upper limit of what you should be having on a daily basis. And this is one of the things which really causes problems in many people. Just to go through why someone might be absorbing more than others. So for instance, you can take a group of people, you can give them all a high oxalate diet. There are going to be certain people who are absorbing a lot more than others. And whilst I said before, the composition of the oxalate is going to differ. So for instance, if it's insoluble, you're not going to absorb it. Whereas if it's soluble, you are. There's also individual variation which are going to influence how much someone absorbs. So one of those things is actually the composition of the gut microbes. Like I just said, gut microbes have been shown to degrade oxalate and effectively protect us from that. So they're called oxalate degrading microbes. And essentially, we can eat oxalate, but actually we're only going to absorb a certain portion of that because these microbes are going to degrade it and get rid of it for us. So they are considered to be protective. However, if you look at the clinical research, there are associations between chronic antibiotic use. Certain antibiotics are actually capable of destroying certain gut microbes. And so there's this idea that if we kind of pummel our gut with antibiotics, with pharmaceuticals, with various chemicals which have antibacterial properties, what they may be doing is preferentially killing off these microbes and rendering us more likely to absorb excess oxalate. Likewise, sorry, go ahead.
Oh, yeah. Oxalobacter, I wanted to mention, I read a study that said that doesn't thrive in a high oxalate environment. It actually thrives more in like a medium-low oxalate environment. So even a high oxalate diet is not good for Oxalobacter.
No, exactly. Yeah. When you give it too much, I mean, Oxalobacter is like the, it's the most well-known one. It's like the characteristic kind of oxalate degrader. But actually, yeah, when you feed it too much, so if you're constantly bombarding it with all of these really, really, really high oxalate foods, it doesn't like it. you actually inhibit it. So yeah, that is a problem. There's a couple of other things which have been characterized. So if someone has fat malabsorption, this can affect how well you're processing calcium in the gut, and therefore it's going to render there less calcium, less free calcium in your diet or in your gut to be able to bind with oxalate to form that insoluble salt to stop you from absorbing it. And then there's lots of other things, but we could talk about this probably for hours, and I know we're stretched for time. But one of the main predisposing factors, I think, aside from a high oxalate diet, which is going to be the main thing, is pre-existing gut issues and intestinal permeability. So if someone has a leaky gut already, which is very common, and which is with the glyphosate, with the kind of chronic, the malnutrition, all of the different chemicals and dietary factors that we come into contact with today, intestinal permeability is really quite common. And so if someone has this condition, then they are going to be a lot more likely to absorb more oxalate than the average person. And so this kind of speaks to why you need to work on all fronts. If you think that you've got an oxalate problem, then actually you need to be looking at the entire individual as a whole. Just to quickly go through this, and something I haven't mentioned is that oxalate is not just present in food, it's actually produced in very small amounts in the human body. Now, this is very normal. This is part of normal human metabolism. We're meant to produce a very small amount. It's as part of something called the glyoxylate pathway, without going into any details. Now, ordinarily, this doesn't occur very much, but when there's certain conditions, if someone has certain nutrient deficiencies, it's possible that they are going to be making more. If the liver is under lots of oxidative stress, if someone is diabetic, for instance, they're making lots of the precursors, which can then go on to make more oxalate in the liver. It's important to note that actually some of these nutrients, so vitamin B6 and thiamine, vitamin B1, I think that they can actually also be depleted by oxalate. So if someone's on a high oxalate diet, they're potentially going to be producing the scenario or fostering the conditions whereby their body starts making its own. And if someone has that, then they need to address the underlying root cause. Going on a low oxalate diet is not going to necessarily address that. They need to kind of do some testing and find out exactly where their biochemistry has gone slightly wrong. Okay. Just the introduction to the concept of dumping. As I said before, that the body doesn't have any specific way to detox oxalate. So what it does is it essentially liberates it from tissues. So when someone has been on a previously very high level of oxalate in their diet, their blood levels will be high and they will be kind of accumulating it in various tissues and getting rid of what they can. Now, if someone drastically gives up, like for instance on a carnivore diet, your listeners might be familiar with this, or they just go on a low oxalate diet and kind of cut all the oxalates out immediately. What can happen is the blood level of oxalate comes right down and they start liberating it from tissue. And when they liberate it from tissue, this is picked up by the immune system. It activates the inflammatory response. It can reignite or it can kind of re-exacerbate all of these other kind of previous underlying health conditions. So any joint pain is likely going to get worse. It can make the bladder symptoms a lot worse. It can make all of the kind of symptoms or health problems which have been caused by oxalates are going to temporarily get worse. And this kind of cycles. And so it's really important that someone doesn't immediately cut out oxalates from the diet, because actually you can get a situation where someone, because of the effect it's having on the minerals in the blood, it can actually make someone like immediately or acutely hypokalemic, so low in potassium, low in various minerals. It can cause all kinds of kind of metabolic crises, so to speak, and people can really experience horrible symptoms, and it can be quite severe, and you definitely don't want that. I've had some people who've actually been to the emergency room because they cut oxalate too quickly. And so it's really important that someone tries to find some kind of a practitioner or learns as much as they can about this, and then can come up with a very comprehensive plan of exactly how to do this and at what rate. You definitely don't want to jump into this. But essentially the body will get rid of it in any way that it can. It will get rid of it through the gut, through the kidneys, through the skin, sometimes through the eyes. Many people develop rashes. Some people find, I've got several people who have crystals coming out of their jawline and on their skin. Oof. Many people have crystals coming out of their eyelids. Wow. They have cloudy urination. They have blood in the urine. They have all of these different kinds of things. They might have sandy stools. They might have kind of anal itching, anal bleeding, because if you think you're dumping this kind of glass stuff into getting rid of it in every way possible, and unfortunately it's naturally going to irritate the tissue that it comes out of. So it's something that you just need to kind of...
Elliot, if you can go back to the other slide real quick, the cycling, can you explain that to the listener? Because you said it appears in cycles, 2 to 3 week dumping phases. What do you mean by that?
Right, okay, so essentially here's a kind of scenario. You've got someone who's been on a kind of low-fat vegan diet, has been doing green juices and green smoothies for 3 years. They've developed chronic UTIs, they've developed chronic joint pain, brain fog, and kind of many different symptoms, okay? What they find is they discover oxalates. And so they look at a list of all the different oxalate-containing foods, and then they will decide, okay, these foods are likely potentially contributing to my health problems. I think that this is going to be like the smoking gun. So what I will do is I see that these foods are causing me problems. I see that they're toxic. So what I'm going to do is I'm going to get rid of all of them. So what happens is they get rid of all of the oxalates, but then the body, they may experience a temporary honeymoon phase, it's called. So the symptoms will go away almost immediately. Some people it can be gradual, some people it's immediate. I've had several people who have seen benefits, almost 95% reduction in symptoms within 3 to 4 days. Wow. However, after that, you will see that essentially the body will basically acknowledge that you're no longer intaking this toxin, or you're no longer eating loads of oxalates. And so it will see that it's safe to start getting rid of it. Because the problem is, what you have to understand is that if you have too much oxalate in the blood, too much for the kidneys to deal with at any one given time, you can cause acute kidney failure. Okay, wow. This was well known among, for instance, in the UK, when there have been women who have eaten too much sorrel soup, or for instance, there have been individuals who've eaten too much raw rhubarb who've actually coved over and died within 2 or 3 days because they gave themselves acute oxalate toxicity. Likewise, there's a couple of case studies in the literature not long ago. I think it was last year. There was an individual who was doing 3 green smoothies per day, and actually was admitted into hospital, was in the ICU for 3 weeks because he developed acute kidney failure. Wow. So if you prop up the blood oxalate level too high at any one given time, you can kill yourself. Okay. So actually what the body will do is, when you've got lots coming in from the diet, your body will not release that much because you don't want to overburden the kidneys. Whereas what will happen is that when you cut that out, when you gradually reduce it, then your body, there's a tissue sensing mechanism whereby your tissues are sensing the levels in the blood, and it sees that there's a drop. And so it actually decides, right, okay, now we can get rid of this stuff, which has been causing us so many problems for so long. Does that make sense? Mm-hmm. So then it will start dumping it, and you have this transition of oxalate crystals, or oxalate kind of, whether it be soluble, insoluble, you're dumping that into the blood, and then you're getting rid of it in any way possible. Some people do it more in the gut, and they may get diarrhea, constipation, or any kind of gut symptoms. Some people do it mostly through the kidneys, other people through the skin, other people not. So it's not very well characterized, but essentially it will go in cycles. So it seems to be different for each different person, and there's a circadian variation. So one person may do it at certain times of the day. It may be in kind of the afternoon or the evening. In other people, it may be kind of every 3 days or every 3 weeks. It seems to be more common every 2 to 3 weeks. But in other people, it's less frequent or more frequent. So it's entirely individual. To be able to identify it, you really kind of need to know more about it, right? But yeah, that's kind of this cyclical process. And this can go on for a very long time. You can look at, 2-3 years.
Oh, wow.
Potentially even longer. So Sally Norton has said that, it can go on for 10 years. I don't know about that personally, but all that I know is that people generally, what you have to understand is not like other plant toxins. So it's not like lectins. It's not like gluten. With those things, if you're having a reaction to them, if they're driving your autoimmune condition, if they're driving your gut issues, when you cut them out within a very short space of time, you will likely see improvements. Okay. Oxalate is different. I think this is probably why it's the worst one, because you don't get any necessary immediate effects from eating it. It's a very long, gradual, insidious process where your body accumulates it. And what that means is that because it's accumulated, you can't get rid of it overnight. It can take a very long time for your body to actually get rid of this stuff. Okay.
Wow.
Now, in terms of testing, a conventional medical doctor may measure a 24 urinary oxalate level. Again, the efficacy of this, due to the fact that what we've just been talking about, there's a cyclical dumping process. Sometimes it can be very difficult to identify this, because actually if someone is not in their dumping phase, then they may not be releasing much oxalate at that given time. Whereas in someone else, if you get them right at the right time, it may show up as high oxalate. But what that means is that you can get false negatives. You can have someone who shows up as okay with oxalates, but actually they may still have the problem. It's just they weren't releasing much through the kidneys at that particular time. Okay. Now, there is a test by Great Plains Laboratories in the United States. This is something that does offer 3 metabolites. One of those is urinary oxalate levels. The other one, or the other 2 markers, are more specific to this process of whether your liver whether your cells are endogenously making their own oxalate, okay? Now, again, whilst this isn't completely 100% diagnostic, it can be very helpful. So oftentimes if someone thinks they've got oxalate issues, then more times than not, when you measure their urine, it will usually come back very high with oxalate. Some people I've had, they think they've got oxalate issues. We test, it tests okay. And then we may test it like 3 weeks later and it comes back very high. So ultimately, a lot of the oxalate kind of symptoms, it's going to be based, you know, someone who's knowledgeable, a practitioner or whatever, kind of going through the case history, going through the symptoms, and then the organic acids test can really help to solidify that and identify whether someone's endogenously producing that or not. What it can also do is just give a wide variety of a vast depth of information on various other aspects of metabolism, which are usually affected or usually implicated. So for instance, vitamin B1 status, it can give some information on that, B6, B2, B12, you know, how well the cells are making energy, whether there's any methylation issues. So I usually run this test on most clients that I see. I find that it's an invaluable test to really pinpoint what might be going on. And the oxalate kind of, the additional oxalate markers are just an added benefit for that. And, you know, as I said, it's not diagnostic, but it is usually really useful. Okay. Now, just the last slide, and this isn't something that we really have enough time or resources to go over because it is highly individual, but there are certain nutrients which are generally affected in people who have oxalate problems. So what I haven't said about is that when the kidneys are releasing oxalate, generally one of the things which is going to predispose someone to form kidney stones is, one is if there's any kind of pre-existing inflammation, or if the immune system is active already in the kidneys, this can promote stone deposition. But another thing is actually the level of citrate in the urine. So citrate is one of the intermediates in a pathway called the Krebs cycle. This is how we're making energy, but we use citrate to do lots of other things as well. And one of those things is actually to prevent the formation of calcium oxalate stones. So citrate is generally used by the kidneys to prevent the stone formation. And so low citrate in the urine, which can be caused by several different kind of metabolic conditions, it's quite common, that can promote stone deposition. But that's not only in the kidneys. I would suspect that occurs in many other tissues as well. So actually utilizing some kind of citrate, and it's going to depend on each individual which type of citrate, because some people benefit from magnesium, others potassium, others calcium, others all of them. So it really depends. But generally, these citrates can come in very handy in terms of reducing symptoms and promoting oxalate clearance. Calcium, as I said before, calcium can form an insoluble salt with oxalate. So what calcium can be used for in the gut primarily, calcium citrate, that can be used to bind oxalates. But the timing of that is going to completely depend on each individual and their kind of individual situation. And then there's some of the other B vitamins, and this is for a variety of reasons. Biotin is often depleted by, or oxalate problems can cause a functional biotin deficiency because of the way that it's interacting with the enzymes. So actually, someone can benefit from taking lots of biotin, very high level of biotin. Again, this needs to be assessed on an individual basis. And likewise, B6 and thiamine should also be considered if someone has a history of this and if they are potentially making oxalates in their liver. Without testing, it's difficult to say whether that is the case. But yeah, generally, those are the things that I found to be of use. And that's the presentation.
All right.
Is that?
Well, yeah, you can stop share. There you go. Perfect. So the organic acid test will give somebody the idea, well, obviously the oxalates, but also those deficiencies that you mentioned. Biotin, B1, B6, great. So that's probably a pretty good test for people who suspect an oxalate issue, the organic acid test.
Oh, indeed. Yeah, it's invaluable. It really is invaluable. As I said, I get pretty much all of my clients on organic acids, or most of them, if they can afford it. It is private, so oftentimes these things aren't covered on insurance, but I don't know what it's like in the US.
Same thing.
But yeah, Yeah, yes. So, but essentially, you've got about 71 different metabolites on that test. If you know how to interpret it, or if you've got a good idea of how to interpret it, it not only gives you information on the oxalates, but also some of the B vitamins, how well the cells are making energy, what kind of, whether there's any kind of Clostridia or bacterial infection going on in the gut. There's just a wide variety of things that can really help to pinpoint, and then some special kind of genetic inborn errors of metabolism towards the end, which, sometimes you do get someone who didn't know that they had some kind of a genetic condition. Turns out that they actually do, and it really helps you to pinpoint that as well. So that's usually a good starting point, and it's provides a good baseline to work from.
I'm glad you're mentioning that, because I do run organic acid tests a lot as well, and I'm actually doing some comprehensive training in it in January to really get deep into there. And I think that's a good conversation to have, because a lot of times people hesitate spending money on functional labs. That's one of the hesitations. And so this is the one you really want to put your money on, people, if you're listening, the organic acid test. I also believe the genetic test as well. We're offering that too through group coaching, the 3x4 genetics. In fact, I just did a YouTube live, a Facebook live on the top 3 tests that I recommend. And that was blood chemistry, the genetic test, and then the organic acid was my 3rd one. Those are, if you're going to spend your money, those are the 3, because blood chemistry also gives you a lot of insight as to what's going on into your immune system. And also we run other markers for inflammation, and we can watch a lipid panel, and we do an iron panel, and all that gives you a nice big picture. So, spending money on labs is really the way to fast track your healing. I know it's hard because it's money that you're spending, but this is money spent towards your health, and your health is everything. You can't put a price on that.
And what you often find as well is that actually people end up spending more money on supplements in the long run. They, because it provides immediate benefit, but oftentimes it's just guesswork. And if you're working on guesswork, then actually you end up, you can't identify. Oftentimes you don't need all these supplements. You just need targeted kind of recommendations, targeted things. It can save you a lot of money in the long run. That's what I try to get across.
Oh, absolutely. Test, don't guess. We say that all the time. So, well, it's great having you. I'd love to see you in the future again, and see what the future looks like with oxalates. I think we're starting to finally see people put their eyes on this. It's been around for a while. Actually, 10 years people have been talking, but now I think more people are starting to see this could be a potential root cause of your problems. So what we'll do is we're going to put Elliot's information in this YouTube link, and then we're going to put the IC Healer course, IC Healer website, and I'll put some other resources on there. So if you want to reach out to him, you absolutely can. His link will be on here for you to directly reach out to Elliot. And you may see some future videos with him as well. But he also has a YouTube page as well. Can you share what your YouTube page is?
Yeah, of course. It's just EO Nutrition. EO Nutrition.
Yes, and I've subscribed to that, and it's nice because he puts out videos on a regular basis on a variety of very complex topics, I will say, but very informative. So, well, thank you so much for being here.
Excellent. It was a pleasure. Thanks for having me on.
Thank you.